let me put you on the spot. Are you happy to make a diagnosis of atrial fibrillation with a trace that a patient has recorded in their living room, a good quality one lead ECG trace, 30 seconds of atrial fibrillation? Is that enough for us and for you to diagnose atrial fibrillation to the point of perhaps starting anticoagulation?
A very good question. I think the answer to that, Yasser, is yes. I think the key word that you use there is good quality tracing. So if there is a tracing that is actually not good quality, and you can't actually make any head or tail of what's going on. The key thing is you have a good quality tracing. You have 30 seconds of it. You can clearly see that there is irregularity in the RR interval that is throughout that 30-second period, and actually that there is no discernible underlying P wave. And I think based on that, you can, I think, confidently say that this patient has had an episode of atrial fibrillation. Now, clearly, if it's persistent, you can confirm that with a 12-lead ECG, but you won't always have that, of course, and patients may have paroxysmal atrial fibrillation, where the AF terminates and you just don't see it again. So I think if you have the technology, you can capture that rhythm at the time of the symptoms, and it is a good quality tracing and conforms with atrial fibrillation as defined by these guidelines, then absolutely yes.